Less common than hip or knee replacement is the shoulder replacement. Now, new procedures are healing that complex joint and getting patients back to their normal routines. Larry Courtney is rehabilitating his shoulders.
I fell, hurt my shoulder, and it wore out to start with. I'm working, used to work a long time ago, and just retired. It wore out, and I fell, and that's what started, tore a tendon.
He tore a tendon in both shoulders. He had shoulder replacement surgeries on each shoulder, but the left shoulder is special. The procedure that fixed that joint is a unique one called reverse total shoulder replacement.
This is one example of the reverse total shoulder that's on the market here in the United States. The first reverse total shoulder was brought to the market in the U.S. in 2004, received FDA clearance. This particular model was brought in 2005. And what it does is actually reverses the components of the shoulder. So normally you have, as you remember from the previous model, you have the humeral head, which is here at the top part of our shoulder bone, and then you have a socket, or the glenoid, on the inside.
Dr. Ryan Krupp did the procedure on Larry's left shoulder.
Mr. Courtney presented with classic rotator cuff arthropathy. And in that, he had pseudoparalysis, which once again is effectively the disuse of his shoulder because the rotator cuff was no longer functioning. In addition, he had a great deal of pain. It kept him from sleeping, and really he was becoming quite debilitated because of this dysfunction. So what we proceeded with was a reverse total shoulder. So the reverse total shoulder literally reverses the normal anatomy of the shoulder. It takes the socket, which is normally on the glenoid, and puts it on the top of the humerus, or the upper arm bone. And it puts the socket, it puts the ball, which was normally on the top of the upper arm bone, or the humerus, on the socket. So what it's done is it increases the stability of the shoulder joint with the cup and ball positioning, and gives the deltoid muscle, or the muscle on the outer portion here of the arm, the ability to do the work the rotator cuff used to do.
Reverse shoulder replacement is very different from the more common total shoulder replacement. We are here at Norton Brownsboro's Surgical Services, where Dr. Krupp and his team are about to perform a total shoulder replacement. Not a reverse total shoulder replacement, just a total, which in itself is pretty amazing.
So now we're ready to begin the actual procedure of doing the arthroplasty. You see there's a lot of preparation work just to get to this point. These are reamers, which actually ream out the canal, the central portion of the bone.
In orthopedic surgery, hip and knee replacements far outnumber shoulder replacements for a number of reasons. Hips and knees are weight-bearing, so pain in those areas are more likely to impact your lifestyle. But the shoulder, while not weight-bearing, is very important for daily activity, which can be modified more easily than a hip or knee. And the shoulder is a very complex joint with more than 30 different ligaments and tendons that provide stability to the joint.
Here, we've merely cut the top of the bone off, replaced the damaged cartilage bony interface with a metal ball, and replaced the cartilage that's lost on the glenoid, or the socket side of the shoulder joint, with a polyethylene or plastic component. So this looks more like normal anatomy. It's the normal glenohumeral or shoulder joint. And you can see that's completely different than what the reverse total shoulder provides. So if it's garden variety arthritis, we proceed with the total shoulder, a standard total shoulder, because it looks like normal anatomy. But once again, if you don't have a rotator cuff, this is not a very good operation because you still don't have the function and the stability provided by those soft tissues.
It was that garden variety arthritis and an injury that led Larry Courtney to have both procedures on both shoulders. Now he has his mobility back.
And before I got through down there for therapy, I was reaching over top of doors. I walked through the door. I couldn't raise my arm much no higher than that. Then I reached over top of the door, over top of my head to go through the door, reach up there and hit the top doors to go through.
So one of the benefits of a patient coming to someone that does a high volume of a certain area of orthopedics, in my case shoulder surgery, is that we have a wonderful team that's put together that we work with on a regular basis and that are seeing these problems over and over again. And we're able to do it in a wonderful setting here at Norton Brownsboro. Starting with the office staff, who are fantastic when we're initially evaluating a patient, it's kind of a streamlined process. And we're able to get diagnostic imaging, which is all the latest technology here on campus, performed in a timely fashion, and get patients moving along, whether that be with conservative interventions or surgical interventions.
So with those shoulder replacements and good therapy, Larry is back to doing those things he loves and sleeping better with pain-free shoulders.